Hello everyone, we are from SGD number B3. Would like to present our student project entitled The Systematic Examination of Sexual Violence Case on Forensic and Medical Legal Studies block. Okay, these are the group members of SGD number B3 which give their contributions to this student project.
Okay, so thank you for the opportunity. My name is Niputan Vidya Putri and my last digit of my number is 067. And today I'm going to explain about the background of this literature review. So first, we have to know what is the background of this literature review. First is the high rates of sexual violence, especially in Indonesia. Second, the risk factors that drive the incidence of sexual violence. Third, sexual violence examination that have to do in the cases of sexual violence. And the last one is the health sector can serve as a gateway for people seeking other forms of support. So, as we know, and we concluded about the highest rates of sexual violence that happen in Indonesia, based on the Ministry of Women's Empowerment and Child Protection on January 1st, 2024, shows that have been around 23,000 cases that have occurred and been reported in Indonesia, with the majority of the victims is a women. And about the risk factors that drive the incidence of sexual violence, we know such as lower levels of education, exposure to child abuse, antisocial personality disorder, the harmful alcohol use, and the low levels of gender equality, as we know in Indonesia, we know as the patriarchy. And also, although there are several risk factors, we have to know that sexual violence can happen to anyone. And the examination that we have to do, especially we being a doctor, is the initial assessment, history taking, physical examination, the proving all and new sexual intercourse, recording and classifying injuries, and also the diagnostic tests, specimen collection, and other forensic issues have to be considered when examining victims of the sexual violence. Other than that, we have to know when that things happen to anyone in certain situation, it also may be raise chains of people of having the HIV and a detrimental impact on their physical, mental, sexual, and reproductive health. Therefore, providing comprehensive medical care to someone who has experienced violence, the health sector can serve as a gateway for people seeking other forms of support. That's all my presentation. Thank you so much for the time and attention.
Thank you, Doctor. Firstly, let me introduce myself. My name is Komakian Ragananda with last three digit number is 091. In this section, I will explain about the problem identification. The first is what is meant by sexual violence. The second is how is sexual violence examined and follow up. The third is what are the challenges in proving cases in sexual violence. And the last is what are the medical legal aspects of sexual violence. The objective is first to understand the meaning of sexual violence, to learn about the examination and follow up of sexual violence cases. The third is to identify the challenges in proving cases. The fourth is to explore the medical legal aspects of sexual violence. And the benefit is the to turn knowledge regarding the systematic examination in cases of sexual violence. That's all from me. Thank you.
Let me introduce myself. My name is Amanta Petrona Theobald with last three student numbers 108. So let me continue the presentation. So for the definition of sexual violence is defined by World Health Organization as any sexual act, attempt to gain a sexual act, or other act involving coercion directed against a person's sexuality by any person to the person regardless their relationship in any setting. Article 1, Paragraph 1 of the Law on Sexual Violence Crime defines sexual violence as any act that fulfills the elements of crimes offense as regulated in this law and other acts of sexual violence as regulated by the law as long as they are determined in this law. In accordance with the law, several actions are classified as a form of sexual violence, include the non-physical physical sexual violence, forced contraception, forced sterilization, forced marriage, sexual torture, sexual exploitation, and electronic-based sexual violence. Further explanation of forms of sexual violence is stated in the Article 4, Paragraph 1 and 2 of the Law on Sexual Violence Crimes.
Okay, thank you for the time. My name is Yuda with my last three digit of student number is 069. And in this next occasion, I would like to explain about the legal and medical legal aspect of the sexual violence. First of all, we must know about the regulatory frameworks we use in Indonesia to addressing this issue. The first one, we have Indonesia Penal Codes or KUHP, which includes provisions on indecent acts or crimes against morality, but criticized for outdated and narrow definitions. The second one, we also have Law and Sexual Violence Crimes or UU-TPKS, which enacted in 2022 broader and more inclusive definitions of sexual violence. For example, rape, harassment, forced prostitution, and digital crimes. And then we have KUHP provisions on sexual violence. Articles 285 until 289 address rape and sexual coercion but limited in scope. And in this KUHP, there is also indecent acts recognized but inadequately defined to protect victims. We also have advancement under UU-TPKS, which expanded categories and penalties for various forms of sexual violence, strengthened victim protection and support mechanism, and the last one is promotes interagency coordination for prevention and response. And the future developments we must know about the reform efforts to align KUHP with UU-TPKS principles and debate on integrating UU-TPKS provisions into new KUHP or retaining it as separated law. Okay, that's all from me. For the next speakers, the time is yours.
Let me introduce myself. My name is Ida Bagus Resna Indah Putra Pramana with the last three digit of student number 104. And now I will continue the presentation and will explain about the initial assessment for sexual assault cases. In the initial assessment for sexual assault cases, the most important things to note are first to make sure the patient's urgent treatment and then assure their security and then gathering the forensic evidences and also attending to their physical and psychological requirements. And then patients who have experienced the sexual assault may come to the emergency room alone or with law enforcement present for treatment. And then the medical personnel treating the patient must treat them with compassion and confidentiality as soon as possible. The first patient engagement should be the starting point for the psychosocial assistance, and every doctor who have further contact with the patients must be sensitive and protecting their privacy at all costs. In order to offer prompt support and help during the examination process, cooperation process with nearby social work institutions and even sexual assault crisis centers are crucial. And the presentation will be continued by my friend.
Hello, my name is Tabitha Trinandia Brosumbiring with the last three digits of student number 232, and I will explain you about the history taking on examination for sexual violence. In conducting medical history taking for sexual assault examination, healthcare professional must prioritize creating a safe and supportive environment. This involves selecting a private room, establishing a comfortable atmosphere, communicating in clear and simple language, and demonstrating genuine empathy without passing judge. The primary focus should be on collecting critical medical information, which include carefully recording the patient's health history, documenting any existing injury and symptoms, and precisely identifying the nature of the assault. Psychological considerations are equally crucial in this delicate process. Medical professionals must be attentive to any previous mental health condition, take deliberate steps to prevent potential re-traumatization, and consider consulting with a forensic psychiatrist when appropriate. Throughout the examination, the overarching objective remains consistent to provide optimal medical care while meticulously preserving the patient's dignity, privacy, and psychological well-being. Each interaction must be approached with sensitivity, respect, and patient-centered approach that prioritize the individual's comprehensive health and healing.
Thank you, doctor. In this section, I will explain about the physical examination. Firstly, let me introduce myself. My name is Komang Chandragananda with last three digit number is 091. So, although physical examination is conducted using head-to-toe approach, The physical examination data is categorized into general and specific examination. The body diagrams are recommended to document injuries and assess the victim's physical condition. The specific examination are required to identify physical evidence, and the last is the Hyman examination requires specific technique. That's all from me. Thank you.
I will continue the presentation with recording and classifying injuries. Before that, my name is Mandi Prama Pratnya Prasanti with the last 3 digits of my student number are 064. I will continue with the sign of harassment. The signs of physical violence found on victims of sexual violence indicate an attempt to resist by the victim. These signs may include minor injuries such as small lacerations, abrasions, and bruises. Most commonly found on extraerogenous areas such as the head, face, arms, hands, and back. Other forms of violence are drugging and other acts that cause the victim to become helpless. Next, signs of intercourse. The first is sign of penetration. Signs of penetration can be indicated by tears of the hymen and injuries to the genital area such as lacerations, abrasions, and bruises due to friction with the male genitalia or penis. Injuries on genital area are often occur at the posterior fossa, fossa navicularis, labia minora, and the hymen or hymenal remnant. Penetration can also be into the anal area or mouth. Therefore, signs such as bruises and abrasion can be found in this area. I will continue the presentation with signs of ejaculation. So signs of ejaculation are proved by the discovery of seminal fluid or spermatozoa in the vagina, around the genitals, or on the victim's clothes. If the seminal fluid does not contain spermatozoa, the proof of intercourse can be done by examining the components contained in the seminal fluid, which are acid phosphatase enzyme, spermine, and choline, and also the presence of prostate-specific antigen or PSA in the vaginal fluid can conclusively prove the occurrence of sexual intercourse. Next, time of sexual assault. So the time of intercourse in the sexual violence can be estimated if intercourse can be confirmed by the presence of spermatozoa. So spermatozoa in the vagina can remain mobile for 4 to 5 hours after sexual intercourse, and spermatozoa that have not moved remain in the vagina for 24 to 36 hours after sexual intercourse, and spermatozoa can survive in the vaginal canal for up to 7 to 8 days in the body of a deceased victim. The wound healing process of hymen can also be estimated of the time of intercourse. So the wound healing process of the hymen usually takes about 7 to 10 days after sexual intercourse.
My name is Shokoristi Dewi with rostri digit number 189. I will explain about the methods of proving old and new sexual intercourse. The methods are rely on the combination of biological, physical, and also technological approach. Timely forensic examinations are critical for preserving evidence, as biological traces like semen, DNA, and microbial markers degrade over time or can be lost due to hygienic practice. And advanced techniques such as DNA profiling, differential DNA extraction, and also microbial analysis have significantly improved the ability to distinguish between recent and past sexual encounters, enhancing the reliability of evidence. And physical examinations, including colposcopic analysis, provide valuable documentations of injuries, helping differentiate between consensual and non-consensual sexual activity. The systemic collections and analysis of evidence underscore the importance of swift action and meticulous examination in supporting justice and addressing the complexities of sexual assault investigation. That's all from me. We'll continue to reference. Thank you.
So, hello everyone, my name is Adelia Pramesti with monastery digit number 165, and here I am gonna explain about the specimen collection and diagnostic tests. To prove a sexual violence case, forensic laboratory examinations and collecting specimen for evidence are essential. By Lockhart's principle, which said that the perpetrator will bring something to a crime scene and will traces of it, means that collecting evidence is useful for establishment of sexual violence case and being the initial basis for starting an investigation in finding the perpetrators. Forensic specimens that can be taken from the victim are clothing or foreign objects and fluids around the victim, fallen hair from the head and genitals, or even hair that were removed by combing, nails, blood, urine, vaginal smears, anal smears, and cheek mucosal smears. So collecting specimen for evidence has a certain maximum time limit, so it can be useful for DNA examination, such as 48 hours for specimen resulting from suspected bite marks and oral penetration, 72 hours for specimen resulting from suspected anal penetration, 72 hours for specimen resulting from suspected loss of consciousness because of substance usage, and 7 days for specimen resulting from suspected vaginal penetration. So, samples then examined in forensic laboratory. This step includes proving seminal fluid, DNA analysis, and toxicology studies. Evidence of seminal fluid can be done by examining the fluid under a microscope to find spermatozoa cells. Next, DNA analysis. Semen is most often used for DNA analysis, although other evidence that has been collected can also provide more support to determine the perpetrator's DNA specifically. In DNA analysis, specimen is analyzed through a number of processes, from extraction to comparing the sample DNA band with the reference DNA band. Then in the toxicology study, samples such as blood and urine will be analyzed using the chromatography method to determine whether or not the substance is present in the victim's body. So that's all from me. Thank you.
Hi, my name is Ninyaman Gaby Fernanda with the 3-digit number 126, and I'm going to explain about the challenges in sexual violence. Proving sexual violence presents challenges due to the complex interplay between medical, forensic, and legal systems, each with distinct objectives. And forensic medical examinations face dual tensions, providing therapeutic care and collecting legal evidence. And if conducted poorly, they risk re-traumatizing victims, emphasizing the need for practitioners to be trauma-informed and patient-centered. And then the documentation also poses another challenge, as health and forensic records differ in privacy standards. Without mechanisms to separate them, personal health records may be accessed by legal authorities and potentially misused in court, exacerbating victims' trauma. And specialized training is essential to ensure evidence-based, ethical, and compassionate forensic services.
Thank you for the opportunity. My name is Delivia Gifancius with the last three-digit registration number 088. I will now explain about the documentation and reporting of sexual violence. Accurate documentation in sexual violence cases serves crucial legal, medical, and policy purposes. Health workers should use methods such as written notes, diagrams, body charts, and photography to record findings, ensuring to include key details like demographics, consent, medical history, examination results, treatments, and referrals. Patient confidentiality must be upheld, with records securely stored and shared only with authorized personnel. Photography, used as supplementary evidence, requires patient consent, proper identification, and confidentiality measures. Health professionals play a legal role by providing unbiased, evidence based reports for court use and participating in medical legal training. This thorough documentation supports justice, victim care, and the development of strategies to prevent sexual violence. That's all from me. Thank you.
Good afternoon, my name is Robert Purwo, and the last 3 digits of my name is 148. So in conclusion, sexual violence is an act of coercion towards a person's sexuality and is identified through 3 steps, which includes the initial assessment, history taking, and physical examination. Initial assessment is composed of urgent treatment, security assurance, the gathering of forensic evidence, and fulfillment of patients' physical and psychological needs. The history taking is an act of gathering accurate information, and the last physical examination involves general and specific examination according to the anamnesis to find what is required. However, due to the nature of the investigation, the patients may feel victimized when they are investigated and if done incorrectly. Therefore, it is best to find someone to do it properly and someone who's trained to do so. There are some laws to manage sexual assault. The first main one is KUHP. This involves rape, sexual coercion, and some others. However, it is deemed to be adequate, so another new law was enacted in 2022, UU TPKS, which involves rape, sexual harassment, forced prostitution, and electronic-based crimes. This also involves coordination in preventing and addressing sexual violence and also includes protection. And there's another one which is written in the PowerPoint below, the Health Ministerial Decree of Republic Indonesia. It is usually very used for patient comprehensive care and support. As for the recommendations, it is recommended for individuals and the government to improve prevention of sexual violence through revising of laws, spreading awareness, and developing a culture that prevents all forms of sexual violence. That's all from me. Thank you.
Okay, that's all the presentation of student project from SGD number B3. We would like to apologize if there are any mistakes on this video or in our student project. Thank you for watching.